We analyzed the prevalence of the common NCD risk factors from the 2014 and 2023 national surveys to assess the changes in these. And at this stage, I would like to call my colleague, Ronald Kusolo, to come and present the methods that we used in those surveys. Thank you.
Yes, good afternoon, everyone. So I'm Ronald Kusolo, as I've already been introduced, a research associate at school. So I'm going to present about the study design and the method that we used in the two surveys. So the first survey was conducted in 2014, and then the next survey was conducted in 2023. This followed a nationwide cross-sectional study design using the WHO stepwise methodology. The sample size, we made assumptions of the sample size. We assumed the prevalence of 50% of any of the NCD outcomes, 5% significance level, and then 5% margin of error. And we assumed 80% response rate and 1.5 design effect, taking into account the age 6 categories. So we realized the sample of 4,340 based on the other assumptions for 2023, and then a sample of 4,900 based on the same assumptions in 2014. So this study included adults. These were adults aged 18 years to 69 who had resided in the sampled household for at least 6 months preceding the date of the survey. Then the adult should have been of sound mind and able to give informed consent. And those who were sick and unable to stand without support and other factors were excluded. This is the design in terms of the multi-stage sampling that we applied. So we sampled from the over 78,000 enumeration areas as demarcated by the Uganda Bureau of Statistics in 2014. We used the probability proportional to size to sample about 350 enumeration areas in 2014, and then 310 enumeration areas in 2023. That was the first stage of sampling to give a national representation. And then at second stage, we sampled 14 households from each enumeration area. In cases where there were less than 14 households, all those households were included with probability 1. And then at the third stage, we sampled 4,900 sampled from the 2014 and 4,340 sampled from the 2023 study. Out of this, we realized the response rate. Just a moment. Isn't up here. Okay. So the online group, I don't know whether the screen is now okay.
Yes, it is okay.
Okay, thank you very much. Okay. So that is based on the response rate that we realized. So then on data collection, before the data collection, we had a training of our interviewers, where we made a training on the methodology, on the tool administration, on the ODK data collection tool that was used for data collection. And we ensured that these tools were password protected for confidentiality of our data. And also the sampling of the participants within a household was programmed on the ODK to ensure there is no interviewer bias at the selection of the participants being included in the study. The definition of the key risk factors for NCDs that we considered. The current alcohol use was defined as the percentage of participants reporting to have had consumed an alcoholic beverage in the past 30 days, and current tobacco smoke or tobacco use. So we had about two definitions. There is all forms of tobacco. So percentage reporting tobacco use in any form, either those who are smoking, chewing, sniffing, in any form of tobacco use in the past 30 days. And smoked tobacco was those individuals who were reporting to have used smoking tobacco in the past 30 days. Inadequate fruit, stroke vegetable consumption. This was classified as a percentage reporting to have consumed an average of less than 5 servings of fruit and or vegetable per day in the past 1 week. A serving was considered to be equivalent to a fist like a hand. Inadequate physical activity. These were individuals, the percentage of those engaging in less than 50 minutes per week, moderate activity, and or less than 75 minutes per week of vigorous activity. Then sedentariness, percentage reporting greater or equal to 8 hours a day of sitting or reclining. This is sitting, basically doing nothing, which engages active. And then high blood pressure, percentage with systolic blood pressure of greater or equal to 140, and or having a diastolic blood pressure of greater or equal to 90 millimeters of mercury, and or an anti-hypertension treatment prescribed by a trained health worker within the last 2 weeks. Then high blood glucose, this was a percentage of individuals with fasting plasma glucose of greater or equal to 7 millimoles per liter, and or being on an anti-diabetic treatment prescribed by a health worker. Then overweight was having a BMI of greater or equal to 25 kilograms per meter squared. So when it came to statistical analysis, since this was a national survey, we had 3 levels of weighting to ensure national representative. The first weight was at step 1. So this was applied in the calculation of behavioral risk factors like alcohol, tobacco, intake, physical activity. Because this way, the step 1 is conducted on day 1. Step 1 and step 2 are conducted on day 1. And then step 2 is where we applied calculation of prevalence on metabolic factors like blood pressure, BMI. And step 3, because it is done on the next day of interview, that is after a complete fasting. So we applied those weights to the prevalence of blood glucose. And then we used the AZ statistic in our computations. So let me invite Mary, my colleague, to present the results from these 2 surveys. Thank you very much.
Thank you, my colleagues, Professor Guwatudde and Mr. Ronald Kusolo. Good afternoon to you all. Yes, so my name is Mary Mbuliro, and I will not repeat the other introductions, but I am going to present to you the results of the two surveys. And the focus here of these results was really to compare what the prevalences were across those two surveys, the 2014 and 2013 surveys. So what we see as the blue graph, the blue bar is the results from the 2014 survey, and then the red is 2013. So 2023, yes, thank you. So the comparison is across the behavior risk factors. We saw that these are contributing factors to NCDs. And looking at, for example, current smoke, we see that smoke use reduced in 2013 compared to, 2023 compared to 2014. And according to the p-value, we used the significance level of 5%. So that was below a p-value of 0.05, and we can see that that difference is statistically significant. So we see that when we go to all forms of tobacco use, again, we saw a decline in all forms of tobacco use. However, this wasn't statistically significant based on the p-value. And then ahead to the current alcohol use, where the alcohol consumption within 30 days was the prevalence increased from 28.5% to 31.1% in 2023. And that difference was statistically significant. Whereas for inadequate consumption of fruits and vegetables, we see that the prevalence of people who take the recommended fruit intake of at least 5 servings per day was really high at 87.8% in 2014, and then compared to 86.4% in 2023. This wasn't significantly different. However, we see that the prevalences are still quite high. And then moving on to sedentariness, where we saw this decline from 5.4% in 2014 to 4.7% in 2023. The difference wasn't statistically significant despite the decline. And then the last one was inadequate physical activity, where again, there was a decline in the prevalence from 5% to 3.6%, which was statistically significant. So quickly moving on.
Allow me to emphasize here. Just to emphasize, for example, alcohol use, current alcohol use. It means we have increased, we are drinking more alcohol. So every 3 adult people you see walking, one of them is a current alcohol user. Okay? That's how important it is. And alcohol is a big risk factor for so many things. As you saw from the causal pathway. And then another one I wanted to emphasize is inadequate consumption of fruits and vegetables. This country is so blessed with so many fruits and so many vegetables. But you can see most of us are not eating enough of this. 87.8% in 2023, we are not consuming the recommended 5 servings of fruits and vegetables. And then this reduced a little bit, but non-significant. And in 2023, we are still high at 86.4%. So think about it. We see so many fruits on the streets, so many vegetables. I don't know why we don't eat enough of them. So we need to do a lot of work around that. Thank you, Mary.
Yes, so thank you, Professor Guwatudde, for that emphasis. So as we move ahead with this presentation, these are things we should be reflecting upon. So the other risk factors were the metabolic risk factors, which included high blood pressure, high blood glucose, and then overweight and obesity. So we see with high blood pressure, we have we had a prevalence of 24.6% in 2014, and then 25.4% in 2023. And this difference wasn't statistically significant. But then we also see that it is still very high prevalence for hypertension. And then for high blood glucose, again, we see a rise in blood glucose from 1.5% in 2014 to 3.3% in 2023, which was actually statistically significant. With regards to obesity and overweight, again, we saw an increase in the prevalence comparing the two surveys, which was statistically significant. So we see that actually for the metabolic risk factors, there was a general increase in the prevalence in the 2023 survey. So we went ahead to compare what these prevalences looked like within the urban and rural settings of Uganda, and also comparing the regions of Uganda. So for the risk factor of current smoke tobacco use, we see that the prevalences overall were higher among rural settings compared to the urban settings. However, in the rural setting, we see that there was a decline compared to the urban setting, where there was actually an increase in current smoke tobacco use. But these differences weren't statistically significant. Then comparing across the 4 regions that we looked at in this survey, which were the central, eastern, northern, and western. So again, we see there was a decline across the region, except for the northern region, where we see that there was a rise in smoke tobacco, although that difference wasn't statistically significant. Then for all forms of tobacco use, again, we see that compared to the rural areas, there was an increase in the prevalence in the urban areas, and it wasn't statistically significant. Whereas also the decline in rural areas, there was a decline, however, not statistically significant. When we look across the regions, we see that there was a significant decrease in the prevalence in all forms of tobacco use in the Western region, compared to other regions where it was quite relatively the same. Then with regards to alcohol use, we see that this increase was both in urban settings and the rural settings, and these changes were statistically significant. In urban areas, it ranged from 22.8% prevalence to 28.2% in 2023, whereas in rural, it ranged from 29.9% to 32.4%. Then looking across the regions, this increase was significant in the eastern and the western regions of Uganda. Then moving on to the consumption of fruits and vegetables, which has been highly emphasized, we see that there was a decline of consumption. The prevalence of those people who consumed inadequate fruits and vegetables declined within the urban areas. Although this wasn't statistically significant, it equally declined in the rural settings. Then across the regions, this increased significantly in the eastern region. We see that it raised from 75.1% to 82.5%. However, when you also look at the central region, this decline was also statistically significant. Then moving on to the risk factor for physical activity by, again, that disaggregation of urban, rural, and region. So the prevalence of inadequate physical activities, implying you did not meet the requirement of, say, moderate physical exercises of at least 150 minutes per week or 75 of vigorous minutes. So we see a decline in the prevalence in 2014 in the urban area from 8.4% to 6.5%. Although this decrease wasn't statistically significant. But when we look in the urban areas, It was 42% in 2014 to 2.3% in 2023. And this difference was actually significant. So by region, this decrease was significant. We observed it in the central region and the northern region. But overall, inadequate physical activity remains generally low, below 10%. So we see that therefore we have a low percentage of people who do not meet the criteria of adequate physical activity. Then in terms of sedentariness, and we say that sedentariness is where you are just perhaps seated or reclining, doing nothing. So this sedentariness was measured at greater than 8 or greater. So if you're sedentary for 8 hours or more, you fit this criteria of sedentariness for this study. So in the urban area compared to the rural area, we see that sedentariness decreased in 2023 compared to 2014. That is in the urban areas. However, in the rural areas, there was a slight increase. So, and across the region, we did not really see any significant differences in the levels of sedentariness across the two surveys, as well as by urban and rural. So whereas there was a slight decline in sedentariness, and it wasn't statistically significant, the changes weren't statistically significant. So moving on to high blood pressure. Again, we did not observe any significant changes of the prevalence between 2014 and 2023. So among the urban residents and among the rural residents, as the graph shows, we see that there are changes in the prevalence. However, they are not statistically significant. Similarly, when we look across the regions, the changes we observe in the prevalence were not statistically significant. Although we still emphasize that the rates of prevalence were relatively high, above 20%. Then in terms of the blood sugar, which was another metabolic risk factor for NCDs, we see that blood sugar overall increased in 2014, rather in 2023 compared to 2024. And when you observe this by terms of residence, participants' residences, we see that this increase was more statistically significant in the rural areas compared to the urban areas. The difference we see was statistically significant in the rural areas. And when we move on to the regions, we also observe that the increase in blood sugars was significant in all 3 regions, except for the northern region. So for the risk factor of overweight or obesity, this increased significantly within the rural area. We see that in the urban area, there was an increase, but it wasn't statistically significant. Whereas in the rural area, the prevalence of obesity and overweight increased from 16.2% in 2014 to 19.9%. And then comparing by region, the prevalence increased significantly in all of the regions except for the eastern region. And so the next section, we are going to receive more guidance and discussion, which is going to be led by Professor Guwatudde on how we can reduce some of those risk factors for NCDs. Thank you.
Thank you very much, Mary and Ronald Kusolo, for making those presentations. Now, I think there are some areas where we have made improvements. Our levels of physical activity are high. They were high in 2014 survey, they were high in 2023 survey. And in fact, we improved further Okay, but there are some areas where we have not done so well. For example, consumption of fruits and vegetables, consumption of alcohol, tobacco we have improved, we have reduced. So overall, there are areas where we have made some improvement and other areas where we haven't. And Mary's presentation on urban and rural, the breakdown urban and rural, and then by region, gives an idea where emphasis or attention is required. And these results have been shared with the Ministry of Health. So they are a point where we should make improvement now. But we can start in-house. And what can you do, you in the audience? I prepared 2 slides to give you some guidance on how you can improve any risk factors you may be already having. Tobacco use. We have made some improvement, but if any of you is using tobacco in any form, whether smoking, which is the most common, but there's also chewing and also sniffing, especially in the northern region of the country. Tobacco use is of no health benefit at all. So the advice is that you stop. Sometimes it is difficult to stop, but you can stop gradually and you can seek help to enable you stop. Alcohol use. Alcohol has also been determined to have no health benefit at all. Previously, we thought that it helps in reducing cardiovascular diseases. However, what had not yet been analyzed is that it increases the risk of other non-communicable other diseases and actually overcompensates. So alcohol has been deemed to have no health benefit at all. So it is advisable to also stop. Again, sometimes some people find it difficult to stop, but you can reduce gradually, or if you feel you are unable, you can seek professional help to stop. And then engage in adequate physical activity. Although the prevalence of this is small, there are still individuals who do not engage in adequate physical activity, especially in urban areas, and also those individuals who hold office positions or office employment. Sometimes I come here and I can sit about 4 hours, and sometimes I don't realize I've been sitting for a long time. And then I try to move around. But there are some people who sit on their desk 8 hours continuous. Okay, that is dangerous. Okay? So either you do moderate physical activity, and this is for at least 25 minutes every day. And moderate physical activity is any activity that increases the rate of your heart beating or breathing, and you do that activity for at least 25 minutes every day. Or you can do vigorous physical activity, and this you do it for at least 15 minutes every day. And this vigorous physical activity is any intense activity that only increases your rate of breathing, but also leads you to sweat. Most people think that physical activity must go in a gym. Yeah? At least that's what people here in urban areas think. No, there are so many things you can do, for example, around your home that can increase your levels of physical activity. Many times we want to ride in a car, even for very short distances, but there are some distances which you can walk. Sometimes when I have to go across to Makerere, I walk, okay? And then some people may say, oh, but Professor, you are lying. How can you walk from here to Makerere, main campus? I do, but I do it intentionally for health benefits. And then, sorry, the slides are stuck. minimize sedentary behavior time. This is the work time when you're doing nothing or lying down. Okay, and a sedentary time of less than 4 hours is a low risk NCD risk, and this is what is recommended, less than 4 hours a day. And then between 4 to 8 hours is moderate NCD risk per day. Greater or equal to 8 hours, which is what Mary presented, this is high NCD risk. Okay, and I've already mentioned, we who hold office positions, most times we sit for more than 8 hours. Okay, so it is advisable you sit for some time, stand up, take a walk. Okay, sometimes I walk downstairs and upstairs and people think I'm looking for something. Sometimes I'm not. Okay, so but I do it intentionally. So this is the guidance. And then inadequate quantities of consumption of fruits and vegetables. I've already emphasized this. We have so many fruits, we have so many vegetables. The recommendation is 5 servings of fruits and vegetables every day. And a serving of fruit and vegetables is the size of your fist. Okay, and the recommendation is 3 servings of vegetables and 2 servings of fruits every day. And I welcome you to that vegetable over there. Okay, so you will come and pick. We prepared for you some vegetables here. Those who are online, sorry about that. And then conduct periodic wellness health checkup. Many of us don't do that, but this is recommended at least once a year. Sometimes many people realize when it is too late that they are developing a non-communicable disease. But if you do a health checkup every year, many of us want to go to a doctor when we are fallen sick. But a health checkup is very important. There are diseases that develop, especially non-communicable diseases, they develop without our knowledge silently. So if you do a health checkup at least once every year, blood sugar, blood pressure, blood sugar, BMI, you can do this yourself. It is your weight in kilograms divided by the square of your height squared. Okay, as simple as that. All you need is a weighing scale and then a tape measure to do your height, and then you will know your BMI. And the recommended BMI is below 25. And then kidney function tests. When this is the list when you go to your wellness checkup, and then liver function test. Okay, so I will end there and welcome questions. And those who are online, you can post your questions online. My colleague will help me to pick some of those, but we can start with those who are physically present here. Thank you very much. Yeah.
Time of day in dormant, does it include the time in your asleep and the night you're resting?
No. Okay, so let me repeat the definition. He's talking about the time, the sedentary time. WHO defines sedentary behavior as the wake time, when you are awake, when sitting, reclining, or lying down, when you are awake. And there are so many activities that fall into this category. When you are watching television, when you are in office working on your computer, or when you are just seated there not doing nothing. Okay, all that is sedentary behavior, and the time you spend on those is the time we accumulate to calculate your sedentary behavior time. Yes, please.
My question is concerning the risk factors. I talked about behavior and then mentality.
but as a country also face environmental factors like air quality. So how can the air quality index be assessed and the progress that has been made?
Yes. So in my causal model, there are factors that are missing in that model, but they can be equally important. Environmental factors are also important, and quite a number of them can lead to non-communicable diseases. This model that I presented, those who are online can see it, I don't know why it is not coming up here, is not exhaustive. So there are other factors that could be risk factors for non-communicable diseases, like the environmental factors, like air pollution, including smoke, including air particles. All those risk factors for some non-communicable diseases, especially the lung-related diseases and others. So the list is not exhaustive, and thank you for bringing it up. So environmental factors are also risk factors. Some of them are risk factors for non-communicable diseases. Yes, Dr. K.
Yeah, thank you very much, Prof, for the presentation. We appreciate the input from all your team members. Your observation is really right with what we've been seeing in small studies. So having the national data really makes a lot of sense, and we hope we shall be able to use this as we advance more work in this area. We appreciate that. My concern is about use of pesticide when it comes to fruits and vegetables. You are very silent about that. So what kind of advice can you give to the people who are in here, maybe from online, regarding the use of fruits and vegetables that are contaminated with pesticides? Yes. Another minor observation was about the inclusion criteria. You mentioned that you excluded people of, you only included people of sound mind. And as we move these days, mental health is something on the agenda of WHO, and stigmatization is really high. How did you recruit your participants of sound mind without stigmatizing the other participants?
Oh, okay. Let me take hers and then I will come to you. So the first one is again is in regard to environmental factors, pesticide use, and I co-supervised a student, a PhD student who completed recently, who did a very detailed analysis of fruits and vegetable contamination by pesticides that are used on farms or in our gardens. And there's a very detailed, there are very detailed findings on the level of contamination of the fruits that we consume. And he analyzed the contamination on fruits and vegetables at market, in the market, when they reach the market, and then within the households, those that had already been bought by individuals to be consumed in the home. Because we know that even in the markets, some market vendors spray some, I don't know whether they are pesticides or chemicals meant to preserve the shelf life of fruits and vegetables. And some of those contain chemicals that might not be very healthy for consumption. So I will refer you to the findings of Dr. Semugabo's study, which is very detailed, yes, for guidance on the safety of fruits and vegetables. Now, the second one regarding inclusion criteria of individuals of sound mind. Here it did not come out. Those individuals who could not respond to our questionnaire. So we did not exclude all forms of mental health. As you know, some of the mental health problems are really mild and can allow individuals actually to respond to your questions. So the individuals we excluded are those that were unable or were not in the state of mind to be able to respond to our questions. Thank you. Yes.
Thanks, Professor Guwatudde and the team for that presentation. That's a very important topic to NCD. My question is restricted to the closure pathway. And I'm aware that you mentioned that I didn't cover everything around the closure pathway. And linking that to the finding, my casual observation in the behavioral risk factors, the prevalences. I don't know them correctly if I say that it's almost remain a little constant. They didn't change much, the behavioral, but as far as the physiological and metabolic indicators, they really show that there was an increase, a significant increase from a casual from the presentation. I'm not so sure whether your study also tried to into the details of why you have that increase in the metabolic physiological indicators, and yet at the same time the behavioral factors have remained constant. And in relation to that, I don't know whether between that time of 2014 and 2023, there have been any any plans from the Ministry of Health to look into these issues of NCDs, whether they could also explain any of the things that are happening in this study.
Okay, so the NCD risk factor survey, unfortunately, we do not go into details of identifying determinants of the risk factors themselves. So what we did, we collected only data on the risk factors, but the question you are asking goes into what are the determinants of the risk factors themselves. Unfortunately, we do not collect that data. It requires a more detailed kind of study, and perhaps some other individuals can pick up on some of these topics and do more detailed studies to identify the determinants of these NCD risk factors themselves. And I know that his PhD is on I think mostly CVDs, metabolic syndrome, the metabolic syndrome, which includes some of these. So, and it is good you are asking that. I hope you are going to answer your own questions at the end of your PhD. So we are looking forward to that. Now, regarding the question on whether the Ministry of Health has done anything, yes, a little. It is not sufficient, but at least they have done something. And this was based on our first survey, mostly informed by our first survey in 2014. One significant one, which most of you might know about, is the establishment of a National Physical Activity Day, which is the first Sunday of every July, first Sunday of July every year. And this was launched by the president, I think it was in 2017, because this is seen as a simple intervention. Yes. So they did that, and I think we have seen every year, either the PS in the Ministry of Health, they call on the whole country to come and participate in a National Physical Activity Day. So that is one. And then another one I know of is that the ministry developed a national strategic plan for prevention and management of non-communicable diseases. And there's a document about that. Okay, so there's a plan, but whether that is being implemented or not, I don't know. As you know, we have so many policies in the country, but our problem, I think, is implementation. But I know that document exists and it is on the Ministry of Health website. Yes. So, so far that is what I know that has been done. It is good, but of course not sufficient. Yes. Yes, Doctor.
Professor, thank you, Professor, for the presentation and your team.
Okay.
I'm Nue Irene, and you've discussed the risk factors, but mainly maybe measured on fruits and vegetables. But could it be possible, like for other studies, to look at the foods that are mainly consumed by people in those regions? Because from the slides we're looking at, you would notice that in the north, it is less prevalent compared to the central and western. So if we look at the foods consumed in the different regions, maybe it can help us also promote certain foods that could be lowering the chances of getting those NCDs. Because as we all know, there are some foods that could increase affect the HDLs or LDLs that are key players in what? NCDs. So maybe in the next survey, could that be possible? Thank you.
Okay, okay. I hope everybody has heard her question. It is in regard to food consumption and the types of foods that are consumed, which unfortunately we did not go into. That is a detail that we did not go into. And it requires a whole questionnaire to understand what kind of foods people are consuming. And as you may know, there are various food frequency questionnaires. And the aim of these questionnaires is to collect information, detailed information on what kind of foods individuals are consuming and the frequency of consumption of those foods. And unfortunately, we did not collect that kind of information. But what you point out is important. And I hope other investigators can pick up on some of these and study them in more detail, including the one we are mentioning. Yes. Okay. And Dr. Peter Weiss for you.
Thank you so much, Prof. Good study. I have a number of comments and some
as we conclude.
Some further suggestions. Number one is NCDs are beyond hypertension diabetes. Because even India is NCDs, so many anything which is not communicable is non-communicable. Some people argue, which I think is the case. So I just wanted to speak a little bit about that. Number two, in terms of, I know they are going to do further analysis of the work, especially because, you know, you might struggle with individual risk, is that, especially if you look at it by either individuals or region or staff, because there is always a compound effect. So if I want to know how big was the risk at the individual level, like people had the lyrics, I'm missing what they are, you know, all those different things. But also in terms of regions, if I ask the question, can you rank the regions in terms of the risk factors? In other words, some kind of composite analysis of stuff, because then it will help in terms of prioritizing. Because one will be high in this region, then it is also in the other one, it becomes very difficult to. Then, of course, I'm sure you have most of that analysis anyway. Like analysis by age, by sex, socioeconomic status, because you might find that a lot of these increases maybe are within a certain category of either age, so the population is aging, but also this issue of urbanization. It could actually explain a lot of let's say, the metabolic issues. Then the why, I know you said you were not going into that, but Uganda has a very complex situation. Like physical activity is high, but is it intentional that people are doing physical activity, or is actually driven by poverty? You know, yeah. Most Uganda is the country in the world which makes walk to work, even in terms of prevalence. But people cannot afford it. So the moment they improve their socioeconomic status, they are going to be. So I think there is need for some of these areas. And I would like to suggest that you propose, based on these results, some research agendas. I think it would guide a lot of the additional analysis and also investigation. Because why has there been an intervention for some of these things which are reducing? Example, why is there an increase in alcohol when we have given a law about the smoking? Is it driven by the legislation, or what is it? I think those are important things that will be important to add. And maybe our students actually could investigate some of these issues. And if you could invite also students to do further analysis of your work, I think it would be an important contribution. Otherwise, a very important study. Thank you.
Okay, thank you very much. And this is going to be our last because we have already run out of time. Yes, so the deep analysis on the variables that we collected, actually we have already done that. And there's already a publication coming out of this, which shows a breakdown by age, by all these factors, region, and the other variables. So that kind of analysis is available. But the much deeper information, analysis requiring deeper information, for example, why, for example, alcohol consumption has increased in the country. We don't have that information because that would require a deeper investigation, which we did not do in our survey. Yes, so, and most of the questions that you have made all go into that direction, a deeper study. And I like the idea of some of our students picking up on some of these points, findings where we did not collect sufficient data, and then going in deep and collecting detailed data to find out why are we seeing what we have in these findings. Yes, so thank you for that. And I hope the students who are here in class or online, especially those who are doing master's level and even PhD, perhaps they can pick up some of these topics. Yes, I hope I've answered. Yes. Okay, thank you very much. Unfortunately, because of time, we have to end here. But as I mentioned, we have a few fruits here and a little eat, so you can pick one and then, and thank you all very much. And also those who are online, thank you very much for your attendance.
Thank you so much, Professor.
Thank you so much, Prof.
Sorry? No, it is the, what is in the envelope? It is a sumbosa, vegetable, and then, okay, there's some oil, but probably.